Head-to-toe assessment is often taught as a long checklist that students try to memorize step by step. In real clinical settings, that approach rarely works. Patients do not present in neat sections, and nurses do not have unlimited time. What matters is having a structured flow that adapts to the patient in front of you. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many students believe a head-to-toe assessment must be performed exactly the same way every time. In reality, it is a flexible framework that helps nurses quickly identify problems while maintaining consistency. The goal is not perfection. The goal is to recognize what is normal, what is changing, and what requires immediate attention. Think of head-to-toe assessment like scanning a room when you enter it. You do not inspect every object with equal focus. You notice movement, sound, and anything out of place first. Nursing assessment works the same way. General appearance, level of consciousness, breathing, and circulation are noticed immediately, even before hands-on examination begins. At the bedside, nurses start observing the moment they see the patient. Is the patient alert or confused? Is breathing labored or relaxed? Is the skin pale, flushed, or clammy? These early observations guide the rest of the assessment and help prioritize care. As the assessment continues, nurses move systematically through body systems. Neurological status, respiratory effort, cardiovascular signs, abdominal findings, skin integrity, and mobility are evaluated in a logical sequence. While this structure exists, nurses adjust based on patient condition. An unstable patient requires focused assessment. A stable patient allows for a more complete examination. Head-to-toe assessment is not just about finding problems. It establishes a baseline. Without a baseline, nurses cannot recognize subtle deterioration later. This is why initial assessments are critical, especially at admission or shift change. In hospitals, long-term care, and community settings, head-to-toe assessments support communication between healthcare providers. Clear documentation allows changes to be identified quickly and escalated appropriately. When nurses assess consistently, patient safety improves. The nclex reflects this reality by testing observation and prioritization. Questions often describe patient findings and ask what should be addressed first or which information is most concerning. The correct answer is usually tied to recognizing abnormal findings within a structured assessment. In practice, experienced nurses do not rush through assessments mechanically. They pause when something feels wrong. They reassess when values do not match the patient's appearance. This critical thinking turns assessment into a clinical tool rather than a routine task. Now that you understand how head-to-toe assessment functions as a real clinical flow rather than a checklist, the next step is learning how nurses interpret assessment findings to guide care decisions. That connection between observation and action is where nursing judgment becomes powerful. And that's exactly where we'll go next here at the Learning Studio.